Okay, so the first cut will be with a scalpel. This will be the one and only time you're absolutely required to use the scalpel, and you're only going to make a small 1 to 2 centimeter incision. So I'll just start right here. I'll push the hair out of the way as best I can and try to find some naked skin, and then make a very shallow incision. As shallow as you can, within reason. So 1 to 2 centimeters is about what you need. And once you've got that, you're going to test to see if it's deep enough. You'll take a pair of forceps and try to slide underneath the skin, between the skin and the muscle layer. And if it's not deep enough, then you just go back and deepen the scalp cut. But this may be good enough, so let's take a look. If it is deep enough, you should be able to slide the forceps like so between the skin and the muscle layer. And you can see it like that. Okay. So the great part about this is once you're able to get underneath the surface, you can actually slide the forceps between the skin and the muscle in the direction that you want to cut. So I'm just going to slide this all the way down as far as I can, and this will give us a much safer cut. Safer in that we don't want to cut the muscle underneath, we just want to cut the skin. So we have some cleared, and I can even take a larger pair of forceps and try to make it even better. There we go. So now we have a lot of space between the skin and the muscle, and so at this point I can take a pair of scissors and cut all the way down towards the anus from here. So if you notice, I'm going to take the blunt side of the scissors and place them down. This is the safety aspect. This is why we don't use the scalpel for this cut. We use the pair of scissors. And all the way down, in fact, we go. Okay. Great. So there's your first incision. Now, we're going to have to do a little bit more work because even though we've gotten through the skin and the muscle layers underneath it, we need to peel the skin away from the muscle. So a couple techniques. What you're going to do first is basically just use your hands. So you can just peel the skin back, but generally when you're doing this, you'll want to hold the muscle in place. So I usually use one hand, my off hand, to push on the muscle down, and that'll give me leverage with which to pull the skin away, like so. Okay. What you'll notice is what is actually being ripped is this cobwebby stuff right here. This is areolar connective tissue, a very, very flimsy and elastic connective tissue right there. And as you can see, I can rip it with my fingers, like so. And that is probably the easiest way to separate this. In fact, I do most of my skinning with my hands. And so now it's cleared in that side. Now I'll do the same thing over here and try to skin this area. So again, I'll press down with my hands on the muscle and peel the skin away. And again, there is that cobwebby connective tissue, the areolar connective tissue right there. Now, one more technique I'll show you right now before we get too far is what happens if you get to an area where your own finger pressure is not going to be enough to cut this, where you can't push through it and you can't rip it safely. At that point, you can actually use the scalpel, but this technique is all about being safe and not cutting any of this muscle tissue underneath. What you need to do is feel free to cut this areolar connective tissue with the very tip of the scalpel, but don't cut down here where the muscle is, just cut right against the skin surface. So you just tap it, tap it, tap it, tap it, tap it, tap it, and you can see it just ripping away. And there it goes. Okay, so that's what you're going to use in especially difficult circumstances, or if you're trying to move fast. I tend to just use my fingers because, in truth, that ends up being the fastest thing for me. As you can see, I can now reach pretty much my entire set of fingers underneath the cat, and that took all of about 5 seconds. So there's our first incision, and now we've cleared the skin away from most of the tissue underneath. And you should be just as aggressive as I am. Once you've gotten in between the skin and the muscle, there is no danger really of harming anything. I'm going to extend this cut all the way through. Remember, I clear the skin away from the muscle and the fat underneath it first, using my fingers or a pair of forceps, and then I follow with my scissors, putting the blunt side down. That's incision number 1.